Dr. Danny Avula said that they are doing that because they are not expecting an increase in their weekly shipment of the vaccine from the federal government for several weeks. Dr. Avula says that last week they got around 105,000 doses, but they had requests from around the state for around 300,000. And last week was the first time they weren't able to fill all those requests as more districts are moving into phase 1B of the vaccine rollout and increasing who is eligible to receive the vaccine at this moment. He says that going forward, they're expecting around the same amount each week and will distribute around the state based on the percentage of the population. While not ideal, he says he hopes that this gives health districts a better idea of what they're going to get and to plan for how to use that and potentially get to advertise upcoming vaccination events. But he adds that unless there is a significant increase in the shipments, it could take 2 to 3 months to get through phase 1B. Now, Avula was also given a lot of questions about that administration gap of the percentage of doses that were administered versus distributed around the state. He says that they are working to close that, but says there's always going to be a discrepancy. They won't always be at 100%, but say they are looking at some ways to improve it, including redistributing some of the vaccine that's part of the federal program to vaccinate long-term care facilities through CVS and Walgreens.
Both CVS and Walgreens will be getting to us with the amount of vaccine they think they will need for that task, and that they would be willing to allow us to reallocate to other pharmacies. So I'll know probably Monday or so what that number is and how we would go about approaching that.
Now, Avula says one way they're looking at that is reallocating those doses to pharmacies that already have relationships with some of the long-term care facilities. Now, he adds that the state is continuing to plan for mass vaccination clinics staffed by the Virginia National Guard to get up and running once the supply chain is allowable for increased doses in the state. And again, he said he's been told not to expect an increase in the state supply until around March when other vaccines get approved.